We're going to start off the second part of the respiratory system with bronchiectasis. This is a permanent abnormal widening of one or more airways. The widened parts of the airways are damaged and inflamed. This causes extra mucus to form, which is less easily cleared. It results from destruction of muscular and elastic components excuse me, of the bronchial walls, such as TB, pneumonia, bronchial obstruction, heavy smoking, or inhalation of corrosive gases. Asthma. There are two causes. Intrinsic, this is the non-allergic type, so emotional extremes, cigarette smoke, aspirin, exercise, cold air can cause that. And extrinsic asthma is the allergic type, and allergens can cause that. Three things that make it hard to breathe during an asthma attack. You have tightening of the muscles around the airways. Okay. You have swelling or inflammation of the lining of the airways, and the fluid mucus is filling up the airways, okay, right here. Pneumoconiosis. This is a group of diseases caused by inhalation of inorganic dust over a prolonged period. So silicosis is silica dust, asbestosis is asbestos, and anthracosis, these are carbon deposits, so inhaling coal dust. It's also known as black lung or coal workers' disease. Pleurisy or pleuritis is an inflammation of the pleura. It includes both visceral and parietal membranes. It's usually caused by a viral infection. Normally, a thin, fluid-filled gap, which is the pleural space, allows the two layers of the pleural membrane to slide gently past each other. When these layers become inflamed, their roughened surfaces rub painfully together like two pieces of sandpaper with every breath, sneeze, and/or cough. If excess fluid seeps into the pleural space, a pleural effusion results. A pneumothorax. This is an accumulation of air or gas in the pleural space between the lungs and the chest wall. Typically results in a complete or partial collapse of the lung. Now, a tension pneumothorax. This is a pneumothorax that leads to significant impairment of respiration or blood circulation. A hemothorax is an accumulation of blood and fluid in the pleural cavity. Flail chest is the inability of the chest wall. Inability in the chest wall. Okay, let's start this one more time. It's an instability in the chest wall, sorry guys, caused by multiple rib fractures. The sternum may also be fractured. The flail portion is not able to contribute to lung expansion. Okay? See that? All right. Pulmonary tuberculosis. This is a lung infection caused by Mycobacterium tuberculosis. It's an infectious inflammatory disease spread by droplet nuclei. This is extremely contagious. Bacterial infection that can spread through the lymph nodes and bloodstream to any organ in the body, but is usually found in the lungs. Most people who are exposed to TB never develop symptoms. Bacteria can live in an inactive form in the body. Infectious mononucleosis. The virus is shed. This is an acute herpes virus infection, and it's caused by the Epstein-Barr virus, or EBV. The virus is shed in the saliva of infected individuals and is usually spread through the oral pharyngeal route. Once in the body, EBV infects B lymphocytes. And sarcoidosis, the cause is unknown, and it leads to widespread inflammation. Usually starts in the lungs, skin, or lymph nodes of chest. And you see granulomas, and these are microscopic clumps of inflammatory cells that clump together. The immune system overacts, resulting in damage to the body's own tissue. The classic feature of sarcoidosis is the formation of granulomas. When too many granulomas form in an organ, they can interfere with how that organ functions. And the comedian Bernie Mac died of sarcoidosis in August of '08 at age 50. And the last one we're going to talk about are arterial blood gases, or ABGs. We're looking at the pH, the PaO2, the PaCO2, and the bicarb was the HCO3. Now the PaO2 and the PaCO2, whenever you see this little A here, this is arterial blood, and this stands for the partial pressure of oxygen and CO2. The primary dysfunction in respiratory function results in a change in PCO2, and the primary dysfunction in metabolic function results in a change in bicarb. Okay. The normal range, the pH is 7.35 to 7.45. The PaCO2 is 35 to 45 millimeters of mercury, and the bicarb, which is HCO3, is 22 to 26 millimeters of mercury. Now, if they're having a metabolic problem, the body will alter ventilation, and this happens immediately. It's short-term and often incomplete. If there's a respiratory problem, the kidney will selectively excrete or reabsorb anions and cations, and this takes a couple of days. It's long-term and potentially complete. So we have respiratory acidosis and alkalosis and metabolic acidosis and alkalosis. First of all, you want to check the pH. Second, you want to check the PaCO2. Normal PaCO2, the patient is adequately ventilating, and an increased PaCO2, you have respiratory acidosis. Decreased PaCO2 is respiratory alkalosis. The CO2 is acidic, so if you have a lot of CO2, it's going to make the blood more acidic. If you have less, it's going to make it more alkaline. And then you want to check the bicarb. Okay? And that's it. Thank you.